Now, about 25% of the kids who entered the study that they could follow up with continued taking daily essential nutrients for a full year at an average of 12 capsules per day. So they continued the study protocol. About a quarter, another 25% of the children who had entered the study, they were all medication free when they came into the study. About a quarter of them switched to medications as a treatment. And then nearly half of them discontinued all treatments. After that 20-week point, they just stopped taking anything at all to treat the ADHD, and that's how they were a year later. So what were the significant differences between these groups? Well, first of all, let's keep talking about the groups. The kids that were taking daily essential nutrients at a year later were more likely to have had a good response to daily essential nutrients in the first 10 weeks of the clinical trial. That's pretty intuitive. You have a good response, so you continue to take the treatment. These kids that stuck with daily essential nutrients, the kids that stuck with daily essential nutrients also were more likely to have tried multiple medications prior to ever entering the clinical trial. So we can only conjecture as to why this is the case. Maybe they just like to switch things up all the time, although they did stick with daily essential nutrients at 12 capsules per day for a year, so that's maybe not likely. Maybe they just couldn't find anything that worked very well for them, and then daily essential nutrients really nailed it. We can only conjecture as to why that's the case, but they're more likely to have tried a lot of different treatments for ADHD before entering this clinical trial. Now, there's one other significant finding here, and that is that children that were taking daily essential nutrients or medications, in both cases, both groups, were doing better on ADHD, core ADHD symptoms, attention and hyperactivity, than those who had no treatment at all. So if you're treating ADHD with something, it's better than no treatment at all. Again, that maybe is intuitive. But where did daily essential nutrients outperform the other two groups at 52 weeks? Where are those kids doing better? That's the really exciting findings in my opinion. And this is just clinician and parent ratings this time, because a year later, they're not with the same teacher. But the hyperactivity and impulsivity part of the ADHD, core ADHD criteria, was significantly improved in those taking daily essential nutrients over the other two groups this time. So this is really interesting. Maybe the hyperactivity just takes longer to respond than the attention part, which responded in just 10 weeks. We don't know, but that was significantly improved. Also, the children taking daily essential nutrients were less likely to be anxious. There was less anxiety among them. The clinicians noted and rated less depression in these kids taking daily essential nutrients. And again, their overall ability to function was dramatically improved if they're on daily essential nutrients at 52 weeks compared to medications or no treatment at all. And I'd just like to point out with this one, this is additive. This is the same measure they measured at 10 weeks. But this is additional improvement. This is only measuring from 20 weeks to 52 weeks. That was statistically significant. So what happened is they improved in their overall ability to function for 10 weeks, presumably maintained it. Then from 20 weeks to 52 weeks, improved more than that. From that point of improvement, they still improved more to 52 weeks, so that we see ongoing improvement for a year. So the question is, why would anyone stop this treatment if it's so effective? Well, the researchers asked that question, and they asked the participants and the parents why they'd stopped. And the main reasons were cost and the requirement to take a large number of pills. These were the greatest barriers to continuing treatment. Lots of pills, 12 capsules per day, pill fatigue, and cost. Makes sense. Importantly, however, side effects were not identified as a barrier to treatment. And this is really unusual with the psychiatric treatment. Indeed, at a 1-year follow-up, those who stayed on micronutrients did not report any ongoing problematic side effect. That is really impressive to have this kind of result. These kinds of results from daily essential nutrients and no side effects to report. Not only that, but in contrast to the other, alternatives like medications, for example, the researchers state micronutrient treatments appeared to lead to improvements in a number of domains, including the ADHD symptoms, so that's hyperactivity and inattention, but also anxiety and mood. So it's a broader, a more comprehensive effect that leads to just better overall functioning for these kids. And the researchers point out that children with poor emotional control, all these measures about ability to function, tend to have poorer long-term outcomes. So here we're talking about their lives. What's their life going to be like? Including, they say, placing them at risk for future alcohol use. So we're talking about future jobs and substance abuse risk. Studies have correlated ADHD symptoms in children with increased risk of poor long-term life outcomes. And these improvements, the researchers say, the improvements that they measured on mood as well as ADHD core symptoms bode well for improving life outcomes. So if you're taking daily essential nutrients and seeing some improvement and it's costly or there's just a lot of pills to swallow, at Heart and Nutritionals, we know those are barriers to continuing treatment. But we're really interested in efficacy more than anything else, because just like every parent wants for their child, all the parents of the children in this study, what they want is the outcomes. They want the results. They want those improved life outcomes 20 years down the road by solving these symptoms when the kids are young. And that efficacy, we're not willing at Heart and Nutritionals to sacrifice for fewer pills or any other, lower prices or anything. We're trying to deliver improved quality of life, improved life outcomes for people. And so if those are barriers for you, call us, talk to our customer service. We'll do everything we can to help overcome those barriers and any other barriers you have to using daily essential nutrients to good effect to get the best outcomes you can for yourself, or in this case, with these studies, for your kids.